The International Council of Nurses, the ICN, says that it's concerned about the rising number of labour strikes by healthcare professionals across the globe. The ICN has blamed capitalist governments for prioritising profits over human lives, leading to the breakdown of healthcare systems. Nurses from Germany, Finland and New Zealand and Uganda have gone on strike, protesting against stagnant pay and staffing shortages. Zimbabwe's healthcare workers downed tools this week, and a Johannesburg doctor was suspended earlier this month for speaking out against the poor conditions at the hospital that he works at. The ICN found that nearly 1 in 5 healthcare workers have quit their jobs in substantial numbers during the COVID-19 pandemic. Well, to tell us a little bit more about these concerning developments, we're now joined by the CEO of the International Council of Nurses, Howard Catton, who's in Switzerland. Thanks very much indeed for joining us. What would you say is the root cause of all of this industrial action that we're seeing in the health sector?
Good evening, Peter. Good to be with you. As you say, we've detected this very alarming increase in strikes, industrial action involving nurses, and I haven't seen this level of action involving nurses before. I think COVID and the pandemic has undoubtedly been a driver, but it's not the root cause. The reason it's a driver, I think, is that nurses have felt, and many other health workers have felt, that whilst they have given their all, often their rights hasn't been respected. They've lacked some of the basic equipment. That some of them have not been paid. Their working conditions have still been poor. Yet they've heard all of this talk of the fact that they're heroes. But I think that has backfired in a way, and those nurses and those other healthcare workers are saying talk is cheap, we need to see action, and they haven't seen that action. And that takes us to the root cause. The root cause is the underfunding of our healthcare services in many countries right the way around the world. And we see that many of these strikes, as well as being about pay and conditions, are also about concerns that nurses and health workers have about the safety of their healthcare systems as a result of the fact that they've been underfunded for many years.
I mean, when I see countries like Finland and Denmark, I mean, this is the first of the first world downing tools, and then one reads about 50% of the strike actions in the USA last year was in the health sector. What does this tell us about the authorities in these countries? Are they aware and are just choosing not to do anything about it, or are there other priorities? What's going wrong?
You make a really important point that this isn't just a low or a low middle income country issue. We're seeing examples of health workers demonstrating around the world and in high income countries. There were thousands of nurses and health workers on the streets of Madrid this weekend. And as well as the pay and conditions issues, they were saying that they felt that their government had just not taken enough attention, hadn't given the priority to the concerns that they'd raised. This weekend in London, in Dublin, we had nurses and healthcare workers demonstrating. In Finland, you mentioned Finland, nurses who had been on strike. Their government tried to suggest that they would make strike action unlawful. So the Finnish nurses are now saying, well, if that's the case, we will just resign en masse. Uganda and Zimbabwe you have mentioned as well. I am worried that we are seeing from some of the government's deflection, distraction, raising other issues, saying they're going to put in legislation so that people cannot strike, as opposed to going back to the root cause here again, which is the underinvestment in our nurses, in our health workers, and in our health systems. And what our nurses and health workers are saying very clearly, yes, of course, it's about their rights and justice for them, but it's also about protecting our health systems. Without nurses, without the health workers, we have empty buildings. We have no health systems. And we've seen, haven't we, through the pandemic, how when our health systems collapse, that has knock-on and a domino effect on our economies, on our safety, on our security, on our whole way of living.
We've had this conversation before about the shortage of healthcare workers, nursing staff. Did COVID make that problem worse?
So I think what we are seeing is a snowballing effect. We went into the pandemic 6 million nurses short. We've talked about that before. The impact of the pandemic has meant that many nurses have now left. We think that 6 million could translate to 12 or 13 million nurses. What's significant about that is that the nurses who are left and who are now taking action, they're remainers. They haven't left. They're still in the system. These are the people who've stuck with us, who stuck with our health systems right the way throughout. But they are saying we're not valued, and we've not had the respect, and we've not had the recognition, we've not had the fairness that we think that we deserve. They're raising their voices. The risk is, the snowball effect is, that we could now be at a point where we start to lose those nurses and those healthcare workers as well. I think this is a massive wake-up call to governments right the way around the world. And as opposed to blaming nurses or blaming healthcare workers or trying to put in legislation to say that you can't take strike action, go back to the root causes here. None of our nurses and healthcare workers want to take strike action. It's a measure of last resort. And the fact that those nurses who've carried us through the pandemic, who are still in our health systems, are prepared to say now that we will strike, that we will take a break from work because we think the issue is so serious. This should be ringing a loud alarm bell in governments and politicians, leaders right the way around the world.
So the other issue is, yes, we have people exiting the profession, but we also have professionals exiting countries. We talk about Zimbabwe, for example. Just in 1 year, 2,000 nurses have left the country because in the UK, their salaries are 10 times more. How do you deal with that as well? Because you've got people exiting the profession, but you've also got some countries draining resources from other countries.
You make a really important point. And let's just take the example of Zimbabwe. You know, we released our report last week, and then on Monday, we saw that nurses were taking action in Zimbabwe, asking for, an increase of $540 a month as a salary. Lower middle income countries, let's not let them off the hook here. They are not paying their nurses and healthcare workers enough. The nurses in Uganda have paused their industrial action, but are waiting for government to deliver on their promises. And if their paying conditions in those countries are so low, of course, the pull of going to the high income countries is very appealing. For the high income countries, what they have not done is to invest sufficiently in their own workforce. They haven't educated, trained enough of their own nurses, and they are now effectively offloading those costs of education to other countries as a quick fix to shore up the shortages that they have as well. There are international codes of practice on international recruitment, and those high-income countries need to abide by those. I think that we need much more sunlight on this issue around the world. We need to see the data, but I think that we'd also like to see those countries who haven't educated enough of their own nurses, the high-income countries who absolutely could have afforded to do that. It's a political choice not to have done that. But if they are then going to go and recruit from countries who are in a much weaker position to be able to lose their nurses, let's think about how do they offset, how do they compensate for those costs bit like climate change, Peter. We want to offset our carbon emissions and, plant a tree or grow a forest. Well, if you're going to recruit nurses from another country, how about you pay towards the cost of a nursing school, for example?
You talked a little bit about the lack of value and recognition, and I guess isn't always just about money. And I'm surprised to see things like historic inequities, to things like gender, are things that persist.
I think if you look at what nurses around the world are paid, the average pay, what I see is that the average pay for the nurse is about around the average salary for all workers across the economy. And I think that nurses are saying, look, they're highly skilled people. They have to, their education increasingly to a degree level of 3 years. They're in intensive situations every day, literally making life and death decisions. But we pay them at about the average rate of all workers in an economy. Why is that the case? And I think there's a big equality issue there. I think historically we have undervalued the work of nursing, because it's predominantly a woman's profession. We hear politicians talk about it's a vocation, maybe, it's women's work, it's care, it's compassion. These are presented as reasons as to why we don't have to pay as much. And I think that you then combine that with what we've seen and heard through the pandemic. We've seen the true value of nurses. We've called them heroes, absolutely rightly. And they are asking for their rights to be respected. And they're asking for fair pay. They're asking for equitable pay. Because what we also often see is that the salary of nurses falls below a comparable profession. Look at the police, for example, or look at teaching, as professions which you might say are similar education, preparation, responsibilities. Nurses are paid lower. So this issue about what we pay nurses, yes, it's about how we value them, but I think that we also need to be acutely aware that the overwhelmingly female nature of the nursing profession means that there are highly likely, I believe that there are gender inequality issues at play here as well.
Health systems collapsing, are we talking public sector? Because I would imagine the private sector, all it does, puts up its fees, and those that can afford it will go to the private sector, and then they will also draw the good quality nurses from the public sector into the private sector.
I think you're right. I think there are some public and private disparities that we are seeing in terms of salaries and in terms of wage increases as well. So as well as the risk of losing nurses to overseas, you can see nurses moving between, public and private employers as well. But we also have another dynamic that's going on. In some countries around the world, and this happens in Africa as well, there are nurses who are unemployed. So at the same time that we have shortages, we know we have shortages, we have people who are qualified as nurses but can't get work. And that is because governments, public sector employers, are not investing in jobs as well. So we do need to look at this private public sector divide. But we again, I think, come back to how do we fund and how do we pay for our health services? I believe that there's an appetite amongst the public. I believe they recognise the value of nurses and healthcare workers. And I think when you ask the public directly, if you say to them, look, are you prepared to pay a little more tax for health services? They may well come back to you and say, if we know it's going to health services, we'll be up for it. But the problem is our tax just goes into a big pot. Government uses it for other reasons. I think that there is a big debate here about taxation policy, but tax which is earmarked for health. We know that if we're going to pay another penny or two, it goes directly to tax. And I think the other big question, this is a fairness question around our tax policies generally. There are some sectors who have done well out of the pandemic. You know, the energy sectors making a lot of money at the moment. Those sectors who've been providing testing and PPE as well, important work. But there are some sectors that have made profits. Let's look at how we tax those sectors of the economy that have done well through the pandemic to help those that are struggling. Let's think about a discussion with the public about what they are prepared to pay for in terms of tax, if they're prepared to pay for earmarked taxes for health services as well. And let's shift this thinking about health service spending. It's cost. It's an investment. It's an investment in our health. It's investment in our economies. It's investment in the safety and security of our way of life. I think the public get that. And that's why I'm encouraging politicians to have that discussion. Let the people decide.
Howard Catton, thank you so much. Always good talking to you. Let's hope that the powers that be listen, pay attention and take action. Thanks for your time.